On July 27th and 28th, 2013, the 21st International Congress on Nutrition and Integrative Medicine was held in Sapporo, Japan. There were 365 attendees from 20 countries. The many research results were presented with a focus on AHCC and oligonol. Continuous efforts to accumulate and utilize the evidence from global researches in integrative medicine with functional foods were acknowledged by the Hokkaido Bureau of Economy, Trade, and Industry Japan, and this meeting is sponsored by them and held by AHCC Research Association.
またその研究内容もですね、臨床試験にしても基礎研究にしましても非常に奥深いものになってきております。
The 21st International Congress on Nutrition and Integrative Medicine
has also raised a question in some people's mind about
The keynote lecture was given by Dr. Philip Calder, Professor of Nutritional Immunology at the University of Southampton, UK. He talked about the role of nutrition in supporting the immune system, and there were many positive responses indicating a high level of interest in the topic. There were 21 presentations of high-standard researches with a main focus on AHCC and oligonol. Attendees from 20 countries were present, and the presentations were translated live into 4 different languages.
My work is mainly based around looking at the immune effects of probiotics and with prebiotics in healthy individuals. And our work centered on looking at giving healthy individuals combinations of bifidus BB536, which is a probiotic bacteria containing Bifidobacterium longum, and combining this treatment with a prebiotic AHCC. And previous studies have indicated that AHCC may enhance the probiotic effects of bifidus BB536. So we enrolled 40 individuals and divided them into groups of 10 to receive placebo, bifidus 536, AHCC, or combinations of probiotic and prebiotic. And what we found when we sampled blood and identified different immune cells such as the T cells and T regulatory cells and dendritic cells was that there was a change in both phenotype and also in function. We were able to show that different subsets of dendritic cells were of increased prevalence, such as the myeloid dendritic cells, and also when we subdivided myeloid dendritic cells into 2 classes, MDC1 and MDC2, based on surface cell markings, we were able to show that the MDC2 class was increased. The implications of this are that the MDC2 type dendritic cells generally have anti-inflammatory properties, and it may be that AHCC in combination with the probiotic Bifidobacterium longum may favour this type of property.
A poster session was held in the lobby, revealing 29 topics on the presentations. Many people gathered there. Attendees spoke directly to the researchers, and overall interest was raised.
We did some research on AHCC regarding immune system response, and we also did some research on AHCC regarding its effect on cancer stem cells. And we get really very promising results. AHCC did indeed decrease the formation of cancer stem cells, especially the cancer stem cell derived from breast cancer cell line. And cancer stem cells are like tumor-seeding cancer cell line. And if we control those cancer-seeding cells, you can control many aspects of the tumor, especially metastasis, relapse, and recurrence in breast cancer survivorship. So in summary, IHCC could present preventive effect because it will enhance the alertness of the immune system, and at the same time could be also used as the combinatory mechanism or combinatory approach during treatment after breast cancer surgery and chemotherapy.
We did a triple-blinded placebo-controlled trial using AHCC as the experimental arm and placebo as the control arm for patients with head and neck carcinomas such as nasopharyngeal, tongue, and maxillary carcinomas undergoing radiation therapy together with chemotherapy. So the parameters that we observed include the onset and the incidence rates of mucositis, dysphagia, as well as laboratory parameters, and we also measured the quality of life for these patients undergoing concurrent chemoradiation therapy. For our research, we noted that AHCC significantly improved the patient's quality of life for patients with head and neck carcinomas. And we believe that if we use AHCC for other tumors, such as, let's say, breast cancer, cervical cancer, we might get the same results for this. So these are applications in tumors, in oncology, in cancer, and we believe that with AHCC we can improve patients' quality of lives by taking AHCC together with their prescribed treatments.
After the lectures on the first day, everyone gathered for a reception. It was an event where attendees were able to communicate with and deepen relationships with people from different fields and exchange important information with each other. A ceremony took place there to present awards to researchers with outstanding results. AHCC Research Association rewarded the following: Promising Research Award, Young Investigator Award, and Best Poster Award. Finally, the Best Research Award was awarded by Hokkaido Bureau of Economy, Trade and Industry, Japan.
We're studying a combination of AHCC and BB12 in healthy people. So this was a randomized placebo-controlled study containing 50 people participated. And the design of the study was that people took either a combination of AHCC plus BB12 for 4 weeks or placebo for 4 weeks. And after this, they received the influenza vaccination. And then they continued to take either the AHCC BB12 blend or placebo for 4 weeks. And what we did is we collected samples and we looked at their circulating types of cells in their blood, as well as numbers, as well as a vaccine-specific immunoglobulin production. And what we found was that following the initial 4-week consumption of AHCC BB12, we saw an increase in certain antigen-presenting cells. These included myeloid dendritic cells, as well as monocytes, and also specifically the CD14 and CD16 double-positive monocyte cells. And we then found after the immune challenge, the vaccine, the influenza vaccine, what we found was that there was an increase in vaccine-specific immunoglobulin production, specifically the IgG3 and the subclass IgG3, the subclass IgG3, and that these were significant results, particularly in the individuals who took the AHCC BB12 and not in the placebo group. And from this, we can concluded that the initial phase of 4 weeks had a beneficial effect on increasing antigen-presenting cells, and therefore, after an immune challenge, the immune system was better able to respond to this challenge and produce more immunoglobulin.
For me, it's many kinds of diseases like asthmas, chronic asthma, autoimmunology diseases like rheumatoid diseases as other one. We have the good experience in child when we use the dose approximately 1 gram per day with little child with asthma, with chronic asthma. It's like good results. I think I hope that the next study will be in the use in HCC in patients with inflammation of thyroid, because there is a very big problem I think it's not only Europe and Japan may do this. I think it's mainly we want to use in Hashimoto disease. This will be the future focus on our study in Poland.
After the presentations, a general discussion took place. The topic of this year was functional foods and human intervention studies. The attendees debated in how human intervention studies could be conducted effectively. This was the 21st International Congress on Nutrition and Integrative Medicine. Every year, high-quality research results have been presented, and evidence of functional foods have been accumulating steadily. AHCC Research Association will continue to discover the ideal purpose of functional foods.